A clinic in Eastleigh is putting on a series of events about women's health. Throughout September, they'll give women the chance to learn more about a variety of different health issues and discuss them with experts. This year, the Nuffield clinic has added breast health to its calendar for the very first time. And just a note that on Nicole Ris's report, it does contain some nudity.
When it comes to breast cancer, an early diagnosis is crucial to tackle the dangerous disease. Detecting changes like lumps or an inverted nipple are a way of getting help in time. That's why the Nuffield Clinic is currently inviting women to learn more about breast health and talk about health worries.
I see women who are worried about changes in their breasts, namely breast lumps, sometimes breast pain, or other symptoms that can normally indicate benign disease. But we always try and increase awareness of these symptoms because sometimes they can be red flag symptoms for breast cancer. And so the only way we know is if women are what we call breast aware, which means keeping a check on your breasts. And we normally recommend that women check their breasts once a month. If you're premenopausal and having a regular period, then the best time to do that is the week after your period finishes. If you're postmenopausal, it doesn't really matter. And so by increasing awareness through Women's Health Month, we feel as though we can really make an impact on picking up these breast cancers at an earlier stage and therefore being able to treat them a bit more effectively.
Only 1 in 3 women check their breasts regularly, according to Nuffield Clinic.
Some women that I talk to say they don't really check their breasts because they don't know what they're feeling for. Other women say they don't check their breasts because they don't know how to do it. And checking your breasts really is quite a simple technique. It just involves the last thing of the day when you're resting in the bed in the evening, just checking each of your breasts in a systematic fashion, including the nipple and the armpit. Looking at yourself in the mirror when you're naked and just seeing if there's any skin changes, tethering, puckering of the skin. The other place that women can check their breasts is in the shower. So when they're about to soap themselves or they're washing themselves, they can very easily check their breasts, and that's quite a good way of checking for any lumps or any distortion within the breast. If there are any issues that you are even unsure about, the first port of call should be their general practitioner, and the GPs are a very, very good source of support and advice, and if there's any question of doubt, then they can refer on to see us in a breast unit.
Another way of checking are mammograms.
Every woman between the age of 47 and 72 locally should have a mammogram every 3 years. And if that mammogram shows any abnormality, then they'll be referred in to see us at the breast unit.
Finding a lump doesn't necessarily mean that it's breast cancer.
80% of lumps that we assess in the breast clinic end up being benign. So if you find a lump, you must not assume straight away that you've got breast cancer. But it's important to get it checked out. Sometimes we say to women, well, if you leave things for 2 or 3 weeks and the lump doesn't disappear, or certainly if it gets bigger, then that's a good time to call your GP and get a referral in. But more often than not, as I say, if these lumps are benign, they tend to resolve of their own accord. But it's important to get it checked out if it persists.
In the UK, around 55,000 women are being diagnosed with breast cancer each year. But thanks to advances in medicine, survival rates have significantly improved.
Breast cancer treatment and breast cancer prognosis, so survival, is better than it's ever been. And that's not only because of advancing surgical techniques, but also because of advancing medical and oncological techniques, so better chemotherapy, better radiotherapy, and a better team working approach between the surgeons and the oncologists. So if, God forbid, you are diagnosed with breast cancer, your outlook and your survival is much better than it's ever been. And more than 8 out of 10 women who are diagnosed with breast cancer today will be alive in 5 years' time.
Nicole Ris, for That's Solent.